Good morning, and thank you for joining us today. I want to welcome you to the California Department of Public Health Childhood Lead Poisoning Prevention Branch's Lead Week webinar series. My name is Jessica Ruggiero, and I lead our Community Outreach and Education Unit. Before we start the presentation today, I am going to go over some of the webinar settings and features. The audience will be muted to give our speaker an uninterrupted presentation. The Q&A button on your screen allows you to type questions for our presenter. If you don't see a Q&A button, you may type your questions into the chat, and questions will be answered at the end of the presentation. Captions are available by clicking on the button labeled CC on your screen. And if you don't see the CC button, you can go to the More button at the top of your screen and enable captions there. Please note that this webinar will be recorded, and the recording will be available on the CDPH YouTube channel next month. This year, our Lead Week series will focus on lead in consumer items and common goods such as food and spices, toys, cosmetics, and remedies. In addition to our presentation today, you're invited to join us for 2 more presentations this week. On Wednesday, we will host the U.S. Food and Drug Administration, and on Thursday, we will host the Consumer Product Safety Commission. You can visit our Lead Week webpage for the times of each presentation and to register for those sessions. And to frame this week's theme of learning about lead in consumer products, I want to start with a hypothetical story about a family with a young child. The parents took their child to the doctor for a regular checkup, and the doctor took a blood test and found elevated levels of lead in the child's body. A week later, their local health department contacted them to provide health information and work together to get their child healthy. The family scheduled a time for the health department to come to the home and find the source of lead that their child was exposed to. The health department tested the paint and dirt in and around the home. They even took samples of some of the family's spices, home remedies, and pottery. When those test results came back, the family learned that the chili powder that their aunt brought from another country had lead in it. The family had been using the spice in a lot of dishes over the past couple months. They had no idea that spices could have lead in them, but decided to stop using the chili powder. The nurse shared that it's safer to use spices bought and made in the US because we have stricter rules around food safety. There are a lot of items with lead around us, and it's hard to tell unless you know what to look for or are able to get them tested. We hope this webinar series can help you learn about what to look for so you can keep your families safe and healthy. Today's webinar will be an overview of statewide efforts around identifying and caring for children who have been lead poisoned by consumer items that contain lead. This will be presented by Siavash Azari. And Siavash is an environmental scientist at the California Department of Public Health Childhood Lead Poisoning Prevention Branch. He works with several programs and agencies focusing on finding and preventing lead poisoning sources that could affect children, such as in consumer products, common goods, jobs, and hobbies. Siavash's work fits well with his passion for using science to improve community health. Before working at CDPH, Siavash earned his PhD in microbiology from The Ohio State University and did postdoctoral research at Stanford University. His research included discovering antiviral drugs and studying how diseases are passed from mothers to children during pregnancy. He studied broad antiviral treatments with potential uses against viruses like COVID-19 and dengue. Outside of work, Siavash enjoys learning new languages, cooking, and trying different foods. So with that, I will turn it over to Siavash. Thank you.
All right. Thank you, Jessica. Let me just share my screen. Okay. Thank you, Jessica, for the great introduction and for the story that puts this presentation into perspective. And thank you to the audience for attending this presentation. Like Jessica mentioned, my name is Siavash Azari, and I will be talking about lead in consumer products and common goods and some of the steps that the state of California is taking to prevent lead exposure from these sources, especially in children who are most vulnerable to it. In this presentation, I will provide a brief introduction of lead and lead poisoning, and I will go over the most common sources of lead poisoning in consumer products and common goods and the activities of the state of California and the Childhood Lead Poisoning Prevention Branch at CDPH in this area. And finally, things that families can do to prevent lead poisoning from consumer products. Even though the Childhood Lead Poisoning Prevention branch or CLIP at CDPH is not a regulatory agency, we strive to build a healthy, lead-safe environment where all children can achieve their full potential. And our mission is to eliminate childhood lead poisoning by identifying and caring for children who are lead poisoned and preventing environmental exposure to lead. In my presentation today, I will go over California's efforts in childhood lead poisoning prevention and what CLIP does to realize our vision. So what is lead and lead poisoning? Lead is a naturally occurring metal that is harmful to the body. There is no known safe level of lead in the body, and lead exposure can cause lifelong learning and behavioral problems. However, the good news is that lead poisoning is preventable. Historically, we've seen lead hazards in houses from paint, dust, soil, and water. We call these housing sources. And non-housing sources refer to consumer products and common goods that are not fixed within a housing structure, including but not limited to food, spices, toys, and cosmetics. And the focus of my talk today will be on consumer products and common goods. Children below 6 years of age are most vulnerable to lead poisoning due to their developing brains and nervous system. And communities that use or are exposed to imported products are also more vulnerable because imported foods, spices, pottery pose higher risk of lead exposure. Here is a list of the most common categories of consumer products and common goods that we have found to contain lead. These are food and spices, such as turmeric, which is known for having lead chromate in it sometimes for coloring, and candies and candy wrappers. Toys, for example, painted and metallic toys, which may use lead in paint or the other material. Jewelry, especially children's jewelry, that may incorporate lead in cheap metal alloys and painted pieces. Cosmetics, which imported and traditional cosmetics such as creams and eyeliners may contain lead. Ceramics and leaded crystal, which including those with glazes that may potentially leach lead, and remedies and ceremonials such as Ayurvedic medicine and imported ceremonial items. Here, we're looking at 81 cases of childhood lead poisoning in California in the fiscal year 2020 to 2021. For these children, 99 non-housing sources of lead exposure were identified. So that means because there were 81 children, some of them were exposed to more than one sources. And the sources are 37 were take-home or occupational, 28 were from food and drinks, 21 from cosmetics and spiritual products, 3 from pottery, 1 from remedies, and 9 of them were from other sources such as fishing weights, jewelry, and lead ammunition. So in total, more than half or 53 of the non-housing sources were consumer products and common goods, showing that it is really important to pay attention to these items to prevent lead poisoning. To understand how consumer products cause lead poisoning, we need to understand the sources of exposure by ingestion, because ingestion is the major route of exposure, especially in children. First one is food items grown in contaminated soil. Second is items that contaminate food, because lead can leach into food during preparation, cooking, and serving from lead-containing dishware or cookware, leaded crystal glassware, and old, imported, and damaged kitchenware with lead glazes. And third, non-food sources swallowed by children. So children may by accident or from pica, which is a behavior where someone eats something that is not meant to be eaten, like soil, or because of hand-to-mouth behavior, children can be exposed to lead from cosmetics and ceremonials, toys, or jewelry with lead components. At CDPH, we test collected consumer products and common goods from homes of childhood lead poisoning cases for presence of lead. After analyzing the laboratory test results of collected consumer products from 2016 to mid-2023, we made a list of the items that frequently contain lead in the state of California. Here is a non-exhaustive list of the food items that frequently have lead values equal to or greater than 0.05 parts per million, or ppm, which was our limit of detection. Some may have more common alternative names in certain communities that we have listed here in the second column. And if an item is on this list, it does not mean that it always has lead. US-made products have a lower likelihood of being lead contaminated due to higher manufacturing standards and stricter regulations in comparison to some other countries. Imported items or ingredients, however, increase the risk of lead contamination even in US-made products. So here some examples are chapulines, tea, mango, tamarind, pumpkin seed, millet, noodles, jaggery, and lentils. And here are the spices that frequently have lead contents equal to or above 0.05 parts per million, which, as I mentioned, was our limit of detection. Again, these are not an exhaustive list. So especially the list of spices is very long. For example, here we have turmeric, masala, chili, cumin, coriander, mixed spices, curry, mint, cardamom, asafoetida, and cinnamon. However, there were other popular spices such as ginger, paprika, and red pepper that were also among the other frequently lead-containing spices above our limit of detection. This slide shows the cosmetics and ceremonial powders that frequently have lead values equal to or above our detection limit of 0.05 parts per million. Some examples are henna, sindoor or kumkum, or traditional eyeliners. Some traditional medicine, supplements, and home remedies may contain lead and other heavy metals. For example, Greta and Ozircon are used for empacho or intestinal illness in Latino cultures and contain 70 to 90% lead. Another example is Ayurvedic medicine, which is a traditional form of medicine practiced in India and other Southern Asian countries. These remedies contain herbs, animal products, minerals, and metals, and may contain lead. 1/5 of Ayurvedic medicine purchased via the internet contain detectable lead, mercury, or arsenic, according to an article published in Journal of American Medical Association in 2008. Our data at CDPH showed that more than 70% of Ayurvedic medicine collected from homes of lead-poisoned children contain detectable lead, and more than 26% of them contribute to elevated blood lead levels in children. These products come in different forms, including tablets, ointments, or powders. They may be compounded by practitioners without any labels, and they are not tested or approved by FDA. There are some highly decorated traditional dishware from Mexico, China, and other places. or dishware that is old, worn, chipped, or cracked, dishware made by small-scale artisans, especially those located outside the United States, dishware sold by street vendors or at flea markets that have an increased risk of containing lead. Now, I would like to go over CDPH's work to prevent childhood lead poisoning from consumer products and common goods. So, how does California identify childhood lead poisoning cases? Blood lead tests are required by California law both at 12 and 24 months of age. For children in publicly funded programs for low-income children, including Medi-Cal and women, infants, and children, or children whose families answer yes or don't know when doctors ask, does your child live in or spend a lot of time in a place built before 1978 that has peeling or chipped paint or that has been recently remodeled? 1978 is the year that lead in housing paint was banned in the United States. Other recommended indications for a blood lead test could be sibling, playmate, or other close contact with an increased blood lead level, suspected lead exposure, for example, from consumer products, parental request, history of living in or visiting a country with high levels of environmental lead, or change in circumstances that have put the children at risk of lead exposure. All children with a blood lead level of 3.5 blood level of equal to or greater than 3.5 micrograms per deciliter are offered public health services, which include monitoring and outreach and education, and additional support through public health nursing and environmental investigations. Those may occur if indicated and as resources allow. However, full case management is offered to children meeting full case criteria. Those include home visits and case management by public health nurses and environmental investigations and follow-ups by environmental professionals. The full case criteria are that the child must be below 21 years of age with one venous blood lead level of equal to or greater than 14.5 micrograms per deciliter, or two blood lead levels between 9.5 and 14.4 micrograms per deciliter, and the second one must be venous. How does California identify case-related lead-containing consumer products and common goods? So when the public health nurses are doing their investigations, visiting the child's home, they will ask a few questions. These questions are there products that the child either may have used or consumed recently or is using frequently? Is there a potentially lead contaminated object or toy that the child handles frequently or puts in the mouth? Are there Ayurvedic or traditional or homemade medicines, remedies, or supplements, especially if manufactured outside of the US? Are there traditional or ceremonial or homemade cosmetics and powders that the child uses? Are there imported foods, including baby food, teas, and spices known to frequently contain that are often used for cooking at home? Does the child eat or drink from dishes made outside the United States? And do you have imported pottery or cookware used for food storage or cooking? If the answer is yes to one of these questions, then the nurses may collect some of these items and sample them for testing. And until the results of the tests are known, the families are asked to pause use. Then, if the lab results come back and show presence of concerning levels of lead in those consumer products that were collected, the families will be asked by the nurses to discontinue use and find safe replacements. And CLPPB, or the contracted local childhood lead poisoning prevention programs at the counties or cities, will gather information such as product name, brand, responsible firm, and photos of the items if available. And then this information will be shared with regulatory partners for follow-ups. And this process is most effective when there's enough product information and the product is sold in the US And it is more difficult to follow up when there's some missing information or the product was brought in from abroad by families. So what can families do to prevent lead poisoning from consumer products? Wash your child's hands and face frequently, especially before eating. Wash toys frequently. Avoid giving children imported candy, chapulines, or snacks containing chili. Feed your child meals with a diet high in calcium, iron, and vitamin C. And avoid using handmade, older, imported, and broken dishes or crystal for food or drink preparation, storage, or serving. Also, avoid using traditional remedies or cosmetics that contain lead. If you're not sure, check with your local lead program, which I have provided the links at the end of the presentation. And why not specifically consumer products? We may have also seen work and hobby exposures in our studies, so we wanted to share these other actions you can take to protect your family. So if you work with lead or spend time at places like shooting ranges, take a shower and change before coming home, or remove clothing and shower immediately upon returning home, and handle clothing carefully and wash separately. And another important step you can take to protect your family against lead poisoning is to educate yourself, your family, and your friends. Now that we have become more familiar with lead in consumer products, let's have a quick overview of state and federal regulations and regulators of lead in consumer products. So at the federal level, we have the FDA, which, among other things, issues recalls, market withdrawals, and safety alerts, and the Consumer Product Safety Commission. At California state level, we have the California Department of Public Health Food and Drug Branch that they do science and evidence-based enforcement of food, cosmetic, drug, medical devices, and tobacco laws and regulations. And that includes, for example, sales of candies with greater than zero point 0.1 ppm of lead. And then in California, we have a law called Proposition 65, which requires warnings on products containing harmful chemicals, including lead. And it is enforced by California Department of Justice. So as I mentioned, education is an important step in combating childhood lead poisoning. I would like to provide some information on Proposition 65 due to frequent questions and the need for better understanding of this important law to help families make informed decisions. Proposition 65 warning labels are everywhere and resemble the one that I'm showing here in the bottom right corner of the slide. You may also see them when you shop online, and you may have seen them on your groceries or even in parking lots. So let's understand it a little bit better. Proposition 65 does not ban products. Instead, it mandates warnings when chemicals exceed safety thresholds to promote informed consumer decisions. So it's a right to know law. It applies even when risks are low to empower consumers with information rather than directly regulating or banning substances. And there are penalties that are enforced for non-compliance. And there are over 900 chemicals listed, and that includes lead. Here in this slide, I have provided some information and contact info and resources related to prevention of lead poisoning from consumer products, and the links will also be in the chat so that you don't have to worry about copying or taking screenshots. With that, I would like to thank my colleagues at the Childhood Lead Poisoning Prevention Branch and open up for questions. Thank you for your attention. Let me see if there are any questions.